The Philippine Nurses Association of Nevada now brings you Philippine Nars, news and features about the Filipino-American nursing community and beyond. And now, here's your host, Doris Bauer.
Well, hello, Philippine Nars listeners and followers. Happy Thanksgiving to all of you. Well, as you know, Thanksgiving is all about gratitude. So, in the spirit of the holiday, I would like to thank you. I am thankful for your continued patronage of Philippine Nars. We appreciate you. And for 5 years now, Philippine Nars continues to be a public service project of the PNANV, the Philippine Nurses Association of Nevada, in collaboration with PHLV Radio. So this year, November 10 to the 16th was designated as Nurse Practitioner Week. This yearly observance honors the nurse practitioners for their dedication to patient care. It is time to raise public awareness to the value of and the dedication of these nurse practitioners who have helped strengthen our healthcare system. Nurse practitioners, as you know, have the same responsibilities as registered nurses. However, actually it includes taking your medical history, administering medication. But the scope of an NP or nurse practitioner goes beyond those of an RN. They deliver advanced nursing care to their patients, and they provide preventative care. They diagnose health conditions and manage treatment of patients in their care. So to tell us more about nurse practitioners, we have invited three special people who are nurse practitioners to be guests on the program today. We have Ms. Emer Sambo, Ms. Nikki Macalalad, and Ms. Cadienza-Calipusan. Welcome, ladies.
Hello, Ate. Thank you.
Thank you.
Oh, sure. We are so glad for you guys to be here to let us know all about your field of practice. Well, I'm gonna start with you, Vian. Can you tell us exactly? Because Vian is the president of FAPARNA, or the Filipino-American Advanced Practice Registered Nurses Association of Nevada, right?
Yes, ma'am.
Okay, you have something to add to that?
I had been a nurse practitioner since 2013, graduated December 31st of 2012.
Wow.
And then 2013 was, I think around May or before June, that's when I took the examinations to be a licensed nurse practitioner in the state of Nevada. So it's been what? It's 2024.
That's like 12
9
years.
years? 12?
Yes.
Oh, wow.
Yes. So I've been a nurse practitioner for 12 years.
Wow, that's awesome.
Yes.
That's awesome. Okay, well, so thank you for that. And Miss Emer Sambo here is also an APRN practicing, and she is the president-elect of the Philippine Nurses Association of Nevada, and will start her tenure next year, 2025.
Yay,
Welcome,
congratulations,
Emer.
Ate.
Thank you. What do you have to say, Emer?
Well, thank you. It's going to be a long 2025 to 2027. I'm looking forward to the PNA, what we're going to be doing on the next 2 years.
Next 2 years. Okay, we got your back. Don't worry.
Yeah.
Definitely.
And of course, we have Ms. Nikki Macalalad here, who is the Director of Education for Optum. She is also the Education Committee Chairman for the PNANV. Welcome, Nikki.
Thank you. Thanks for having me. So I've been collectively, I would say, 29 years as a registered nurse, and out of those 29 years for APRN, I think I'm at 18 years now as a nurse practitioner. So definitely have seen the evolved practice scope of nurse practitioners, and really excited that our state really supports, advanced practice nurses, and gives us the autonomy eventually to be able to practice independently. So our state is really innovative in that sense.
Thank goodness.
Yeah.
Yes, thank goodness. So, okay, ladies, thank you for the introduction. Let me ask you, why did you guys become a nurse practitioner?
Who wants to go
Who wants to
first?
take that on first?
Okay, so I did not want to, but chosen to be. I have a friend, Lou Dizan. She's now the nurse practitioner for heart failure clinic at UMC, and they needed a fourth nurse in their group to attend Charles Drew University School of Medicine and Science in California. So she enticed me and recruited me. And so that is where the start of my journey to be a nurse practitioner.
Oh, that's awesome. That's good. How about you?
I have a similar story with Emer. I got recruited. I was oblivious of like what a nurse practitioner does. And at this time, Luvi and Lotus, my friend, they used to work together in CVCU, all of them. And she's like, Inday, let's go back to school. I'm like, for what? I said, nurse practitioner, what are we gonna do? And she said, let's just go. And I said, okay, as long as you're gonna be there, I'm gonna be there. But so that's my answer, and the rest is history.
Wow, my goodness. How about you, Nikki? Why did you choose?
Oh gosh, I mean, my path is really different. I actually have a double degree in economics and political science, so I was really actually going more into like the legal part, but I've always wanted to marry both legal and medical, and so I initially was going to be going to law school, but I was able to get into nursing, and I was like, oh, this could support my career in law, like have a nursing job.
Right.
But then I got married and had kids, and so I finished my nursing. And when it came time to decide to go back to school, I just knew that having this background really would solidify my place in nursing at my work. And so I worked for a federally qualified health center, and they really, our patients really needed, to have providers, that we didn't have enough providers. And so going back to school was that option to give back to the community. So that's when I went back to school.
Very good. So you're still working there at the health center, or you're with Optum now, right?
I'm with Optum now, but this is back east where I went to
back
school.
east.
Yeah,
Okay.
so I went to the University of Medicine in New Jersey.
In New Jersey, okay. So what field are you in now? Explain to us what you're doing.
So I went to school for family nurse practitioner. So there's different specialties within the nurse practitioner field, and I chose family because I worked for a federally qualified health center. We both had, pediatrics, GYN, and primary care for adults. And one of my one of my first experiences at NP was working in a high school. So in New Jersey, we had in the Newark area, which is really a challenged population. The high school that I worked in had the highest pregnancy rate in the state of New Jersey. So we actually had a clinic in the high school. So I was taking care of the pregnant teen mom, the baby of the teen mom, and then their mom. So
Three generations.
I really was taking care of all of them. And so because they had limited healthcare resources, so I took care of them. But I was actually in the high school, and the high school had a daycare in the basement below.
Interesting.
Yeah.
So the mom would go
To school
and then leave the
baby
baby in the daycare.
in the high school and get the healthcare from me. And so that's how I did it.
Interesting.
Yeah.
Wow, I didn't know they did something like that.
That was my first NP job.
Yeah, and now you are with a provider. What do you call it? A payer, insurance payer, right? And what do you do
So I
there?
work for Optum Health, and so we are like, I guess a subsidiary of the Optum payer.
Correct.
And basically, what I currently do is educate all of our providers and really at the best practices in our practice and share that. And I also see patients. I do their annual visits. And so, working with our Medicare Advantage patients, really, identifying what their needs are. Yeah,
right.
So
Yeah.
that's what I currently do.
That's good. What about you, Emer? What currently in what healthcare field are you in now, or your place of work?
Well, I would like to share my path that I chosen
Yes.
since we graduated with Vian in 2012. So I actually started as a home health nurse practitioner taking care of Medicare annual wellness. We see to it that everything has been taken care of, the care gaps, we do that. And then, of course, I spread my wings and became a hospitalist at the Roses, the St. Rose Hospital, and then at UMC. I did nephrology nurse practitioners, and currently now I am a primary care NP at UMC in one of the clinics.
Nice.
So what do we do as primary care NP, or what you call a complex internal med, if you put it that way?
Oh, okay.
Actually, we see to it that we are the first phase of the clinic when the patient comes in as a new patient, and a hospital follow-up, and then continuation of care and comprehensive wellness for the patient. But I think if you look, actually, being a nurse practitioner and a clinic, it entices you to what was your experiences as a nurse. So Nikki has 29 years of experience. I'm sort of following that, but I'm glad that we don't look like it.
Yes.
So when I see patient, I talk to them about cardiac, and I have an open heart background. I do talk to them about their renal cases, and I used to be a manager of the kidney transplant unit. I did chest pain center, a little bit of med surg, so it helps a lot. So when I see them, actually, they're very grateful because I sit them down, and the lingo that I use is the one that the patient and the family understood. Yes.
Yeah.
So the impact is really to improve their life and their medication usage when they get out of the clinic. So they're like, wow, okay, I learned more. So that's the impact that we've been doing in our clinic at this time.
That's
Very
great.
good.
Yeah.
That's awesome, Emer. What about you, Ms. Vian?
So now that we're telling how long have we been nurses,
I'm not gonna tell you guys how long I've been a nurse.
Oh my
I'm a lot older than you guys.
No.
I love it.
this year is
Yes.
my 25th year.
Oh, wow.
I graduated nursing.
Wow.
back
Very
in,
nice.
San Agustin, Bacolod. So I was actually supposed to go home and celebrate, but then we also have our Faperna celebration, so I didn't get to go home. So with that being said, but here in the U.S., I've been here since 2004, so that's 20 years of like nursing here in the U.S. But as a nurse, I'm always like working medical surgical, and before I became an NP, I was in the ICU. Bedside nursing, but in the ICU. So that really paved the way, as what Ate Emer and Nikki said, that your knowledge.
Yeah.
Because it's very important to, as a nurse practitioner, that you have that groundwork, like of knowledge as a nurse, so you know what's normal and abnormal. But anyways, we can talk about that, like forever, But as a nurse practitioner, there's a lot of us in our group that graduated. So whoever gets the first dib of work, we share it. So that's how we worked with home health. We're doing like wellness checkups, and then we go to these patients' homes. I even went all the way to Laughlin.
Yeah. I was just in Laughlin.
Yes,
Yeah.
Laughlin, and I went there. I did like physical, and then I gave them these are the labs that you need to take, and review their medications and stuff like that. So started that way, and then I have a different journey about compared to theirs. They really wanted to clinical. I was doing more aesthetics. I did primary care. I kind of didn't like it. I don't like the charting. It's too much.
It's a
too
lot.
much for me.
It's a lot.
I always say I like to do aesthetics. I did that. I did aesthetics. I actually had my own clinic, but then during COVID, I stopped stop because you don't want to be injecting like right in front of everyone's face. And then after that, a friend of mine, she's one of the first ICU NPs in St. Rose's. So she's like, let's join, like, because we need another NP. I'm like, but girl, like I had been out of ICU for like a long time. And she said, no, it will all come back. So for me, I was there. That was a baptism of fire. Like, since it's a skeleton, like staffing for us, I just like dove in, like, like did like all the intubation, like inserting lines and stuff. Like, it was very exciting because I love, I like something to do with my hands. So I really enjoyed it. So yeah. And then my husband, I was there for just a year, and then like, we have a home health and hospice. And then he said, I think I need you in the business. So that's how I got into home health and hospice right now. So I don't do per se patient care or visit the patients, but I do the administrative side of it.
Yeah.
So the clinical, like decisions and stuff like that, like regulations. So that falls into my hands.
Very good. Three different pathways to go to an NP, which is really interesting. It just shows you the variety of jobs, for an NP. So, which is great. So, can you tell the audience what is the pathway towards getting a nurse practitioner degree? One of you can answer.
So to become a nurse practitioner, of course, you need to have your bachelor's degree first.
Right.
You need to become a nurse. And I could not emphasize it enough that before you become an NP, it's really, really to your advantage to become a nurse first in the field, so you know what's normal, what's abnormal, when to call emergency, because theory presents differently in real life situation. You can read all the books, but if you don't know how to react in that kind of situation, then all those books will fly. So with that being said, so you also go to a what do you call that, master's degree, which is nurse practitioner. And it varies. Ours is like an accelerated program, so we took it less than 2 years, but I think sometimes it can take 2 to 3 or 4 years to finish the whole program, right?
Depending,
and then as soon as you graduate, you take the certification to become a nurse practitioner.
I see.
National certification,
Which is basically you're board certified.
You're
You
board
want to
certified.
be board certified. Most of the practices really want that board certification. They're looking for it, so you have to study for that, and that's like your NCLEX to be an NP.
Okay.
Yeah.
So, can you tell us what is the difference between, because we're it's confusing out there. I said she's an NP and the other one's an APRN. What is the difference between an NP and an APRN?
Okay, so an APRN is Advanced Practice Registered Nurse, and it has 4 components into that. We have the FNP, which it's a family nurse practitioner. So NP is actually embedded as an APRN. And from the APRN, we have the nurse anesthetist, we have the clinical nurse midwife, we have the clinical nurse specialist. So those are the 4 components actually
Under the umbrella
of APRN.
Yes, I see.
So NP is under that umbrella of APRN.
Of APRN.
Yeah. But the NP can be family, adult, what else?
Dermatology,
Pediatric.
Yeah,
There's
there is
different. There's lots of different specialties that you can go. Mental health, nurse practitioner, which we were talking about that earlier today. The need for mental health nurse practitioners is really great here in Nevada. So
Yes, I think I was looking at the chat thread of the PNANB this morning, and we are this state is one of the worst in the number of mental health providers So we need to improve on that.
Yes.
Yes, definitely.
Okay, so we can talk about that a little more, but the scope of practice for an NP actually falls, and as you know, into three main categories or levels. And there is the full authority practice, then there's the restricted practice, and a reduced practice. And thankfully, here in Nevada, you are we are a full practice authority state,
Yes.
which means that you can have a full scope of practice, right, without being supervised by a physician or in collaboration with a physician. So you can practice independently, correct?
Yes.
Well,
Yes.
I believe the new NPs still have to do a
2,000
collaboration.
hours.
Yes,
2,000
2,000 hours before they can have full authority,
I see.
unless you're grandfathered in.
Okay, so 2,000 hours, you still have to work under the supervision
Collaborating.
of-
Collaboration with a doctor, which is, if you're full-time, it's
Right.
only a year.
A year.
Yes,
Because full-time
yeah,
hours
yeah.
is 2050.
2050,
Yeah.
2040 something.
Yes.
Yeah. So, okay. So, well, with that being said, what can MDs do that APRNs cannot in Nevada or vice versa? Have you received any positive or negative feedback from the physicians that you have collaborated with?
I mean, I've been really fortunate in my career to have the best docs that I work with. They're always supportive of APRNs. So I've really not had any kind of like negative, feedback from them. They're really, we collaborate with our patients, it's a team effort. So, but, I've heard stories where it's not always like,
Correct.
Yeah, so-
and I've heard those stories
yeah,
too. So.
but I mean, I've been fortunate to have great experiences. So I would say, it's the other way around. Like, what can APRNs not do that the MDs do? But the way I kind of think about it is I typically will say, I don't do surgery. You know what I mean? Like, that's about it. But I mean, I feel like, and I don't read imaging. That's another thing that I don't do. But for the most part, we're able to prescribe and treat and diagnose. And, I do primary care with my patients and start insulin if I need to, like whatever is needed for the patient, I will try to do my best. And when I've, come to my scope of practice, then I hand it off. So, or collaborate. So I think that, with healthcare and all of the people that we have to care for, there's still not enough of us. So, having that collaboration, I think the docs really appreciate.
Yeah. So me and Van started 2012, 2013, and at that time, there is still a power struggle about nurse practitioner. We were not embraced at that time, but as the years goes on, and there is a shortage of providers. Now, nurse practitioner is widely and accepted and needed at this point. So time have changed from 10 years ago.
Sure has.
Yeah,
sure
and
has.
there's a lot now of opening for nurse practitioner. I think we are the one that opened that door
Yes.
for everyone because
Yes.
we did well.
I think the struggle there because they don't know what to do with us. Because we are not mainstream during that time.
Right.
I still remember that I got that email from one of the nurse leaders that say, we are a full practice authority, blah, 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 blah. We just graduated that time. And then I think we just passed our boards during that time, 2013. That's when SB, Assembly Bill, AB, Assembly Bill 170 just got passed into that we can have full practice authority. So a lot of times these doctors, they don't what is APRN? What are NPs? What are we going to do with them? It's not necessarily that they were threatened, but they just don't know what to do with us.
Right.
Because a lot of our colleagues, my friend, she's one of the first NP of the kidney center. Lou is one of the first NP of cardiology.
Cardiology,
A lot of us were the first NPs of practices.
That's
and they
awesome.
kind of don't know like
What
what
to
to
do.
do with us.
Yes,
Like,
yes,
and
yeah.
then there's like problem with billing, like reimbursements and stuff like that. So there's a lot of struggle. But then as the years go by, like, we got accepted. And I think the other struggle is we worked with these nurses for quite some time. And then all of a sudden we became like, they get orders from us.
Right.
That was a little like,
Yeah. So you could say that those are the challenges that are you still encountering a lot of challenges in your
not
practice
anymore.
right now?
For me, not anymore.
For you, not anymore.
Yes,
It
because-
used to be from a home health standpoint, because I went, APRNs could not
Yes.
prescribe for
Cannot order home
Medicare home health for Medicare patients. Is that still going on?
Yes and no.
Yeah, that is correct. Yes,
Yes.
and no.
Because Nikki also does like a visit.
Yeah.
Because still some, like in our business, all of our NPs still have like counters, like their doctors are still
Signature,
counter signing
right.
the orders.
Okay.
So
yeah.
but I think if they have to like put it into full like the NPs can order, it would really lessen the burden for the primary care, because here in Nevada, we already have full practice authority, and there's a lot of nurse practitioners that goes to the home visit. They
Yeah.
do the home visit. They do all these things for the
Right.
patient. So they really like have the eye. So I don't understand why they like can't
Yeah,
order.
especially in the home, because a lot of patients, sometimes they can't make it to the clinics, and we have a lot of mobile dispatch. Health that goes into the different patients' home because
Yeah.
they are not able to have any transportation, or they can't, or they're pretty homebound. So
Yeah.
it's difficult for them to be transported to MD
Yes.
clinic, right? So the nurse practitioners usually go over there and become their primary physician, sort of, right?
That's what we
Yes.
do. Yeah.
Yeah, it's what we do.
Yeah.
Are you able to prescribe pain management?
Yes, because well, depending. Okay, the protocol that we have actually is that narcotic goes to the pain management. Though we can initiate it because we have that 2,000 hours already, and we were cleared by DEA to do narcotic Schedule 2, which is morphine or hydromorphone. But then we still cannot issue the
Refill.
marijuana. What is that?
Like the
The
medical marijuana.
medical marijuana or
marijuana?
medical cannabis. That's not, I think, within our realm at
practice.
this time.
Right.
Yes.
Okay. All right. Okay. Well, there are more than 355,000 nurse practitioners or NPs licensed in the United States. And NPs are, as you know, the fastest growing occupation in the US. Nevada has like 2,040 NPs as of 2023. So is the job market for NPs still pretty active here in Nevada? Are there a lot of jobs available?
You want to answer?
I think so. I think that in healthcare, again, there is a shortage in providers, and so utilizing APRNs in any practice, I would say, is a cost-effective way of managing healthcare costs and managing our patients. So definitely, I think, within Optum, a lot of our hires, our new hires are APRNs. So
Really?
I get to work with them, and it's really fun to, work with new APRNs and, seasoned APRNs, because everyone brings different experiences. And so I enjoy, so one of my roles is to work with all of the new providers, the new hires, and seeing the APRNs come through. It just gives me, great joy to see new APRNs always coming through. So, yeah.
Yeah. And patients love APRNs or NPs.
Oh, thank you.
Yes, actually, I love my PCP is an NP.
It's the nurse in us.
Yeah,
Nurse
I
in
think
us.
so.
And I think that's a big difference. You know, the way, our experiences, our ends, right? As well as our medical background, it really gives us a different way of caring for our patients, which is different from the docs. Like, I mean, I'm not, like saying anything
It's a
different.
different mindset,
It's a
right?
different,
Yes.
it's a different mindset. It's a different way of,
Interacting
because
with
we're
the
there
patient. Yeah.
at the bedside, all day long. They are not. And so knowing that kind of care, that's what we give as an MP. I feel like when I'm talking to my patients, it's like as if I was back in the hospital. I'm like, hey, how are things going with you today?
Yeah.
Like what makes you happy? What are your goals? Like I'm asking them what are their goals, because that's what I want to work towards with them and work with them on, versus like, okay, here's a prescription, very different.
Yeah, very
So-
different. Very different.
And I'm not knocking docs at all.
No, not
I
at
work with
all.
them all the time, and as a matter of fact, my parents are doctors. So,
Yeah.
like
Who?
yeah, both of my parents are doctors. So, like, I've always, been around that, been around doctors and others in the medical team. So, it's just a matter of knowing that everyone is part of the medical team, is there to help our patients. And so when you have that mindset, it's good for everyone.
And it's ingrained in us when we started nursing school. So I
Yes.
guess that's what the
And
difference
you
is. Yeah.
continue to be the advocate for your patients.
Right,
As an NP, I feel like that's my biggest role, is to be the advocate for your patients, to get them the help that they need right away if they need additional help.
Okay, very good. Thank you for that. So, what are the types of nurse practitioners that are most sought after? Like, those jobs there, or is it easier, or do you have a lot more family nurse practitioners that are needed, or what types?
Right now, see, we talked about mental health. I think the number one need are for psychiatric mental health nurse practitioners here in the
Okay.
valley. And still, nurse practitioners, we work everywhere, but then we became the patient's providers, like especially in my field, home health. There's a lot of people that there's no transportation, they can't get in and out of the house, they don't have family members, they don't have
Right.
caregivers,
Right.
so you bring the care to them.
To them, correct.
So
Yes.
you're a family nurse, mental health,
Yeah, those two. I
acute
think,
care,
Yeah.
Acute care.
NPs.
Okay. There's a lot of NPs in the hospital now.
Yes,
Yes,
we do
yeah.
wound care. We do wound care is a
Yeah.
big thing right now. It's
care.
crazy.
Yeah. Wound
there's so
care,
many.
ER and P.
I think
Yeah, urgent
ER.
care. Urgent care is
Urgent
a big.
cares, yes,
We have a
urgent
lot of
cares.
urgent cares.
Correct.
So I think that's a great place, like the Minute Clinic.
Yes.
Or like those small clinics that
Administration.
where you can get care right away. That's really always needed.
Needed. Right.
Telehealth. We were just
Yeah.
talking about
Telehealth.
telehealth.
Yeah, how
We were
is
just
that?
talking to
So how
about
does that, like say, if you were licensed here in Nevada, you still have to be licensed in a different state in order for them to do telehealth in that state, correct?
I am not sure with that answer, but I would think so, because if you're diagnosing or giving prescription to that person in another state,
Yeah.
you're still encompassing that, that
Right.
border. So you're still under their jurisdiction, because you
Correct.
cannot prescribe a medication if you don't have a license in that.
In that
In that
particular
area,
state.
yes.
Do you have compact licensure?
Not yet.
No.
Not yet. Okay. Yeah, that's
Yeah,
what
we're working on it.
Yes.
we're working on it
Yeah.
too from a regular RN standpoint.
Yeah.
So it's definitely needed. So ladies, what do you think the outlook is for nurse practitioners here in Nevada?
It's very positive. That's what I can say. It is a career that nurses wants to go to at this time, but as what we wanted to suggest is you needed that background of at least
2 years.
2 years, at
couple of
least 2
years, yeah.
years.
Work in the
Well,
field.
yeah, to feel that you did med surge but when we went to school, actually they have this that they want you to go to critical care actually. They want you, it is not required, but it's suggested, even from other schools, that you need to have that 1 year at least of a critical care. And I think that's a good thing.
Yeah.
As a provider.
I think so too.
That's
Yeah,
good.
I think that's really helpful.
Yeah, and just for you
unless
to
you're
be
going
more
to do,
confident.
I mean, even if you do education as advanced practice, you still need that
Yes,
background.
because how can you teach your patients if you have not even like been in that position
You're
that
right.
they have like all these questions, or if they have a wound, or they are newly diagnosed diabetes, like what do they feel like, like you don't have that comparison.
Right. You have to have that experience. And I totally, totally agree with you. Even with home care, which I am at, seldom not hire new grads.
Yes.
Because you have to be, you're by yourself, when you get there, and you have to make your own decision. So
Yeah,
what you
I really
experience,
think for us as we advance in nursing and nurse practitioner, I think we just need more opportunities for like fellowship programs or
Yes.
teaching programs like that. Because for me, I was able to do a fellowship residency, a 6 month fellowship, which really secured my like past the theory, past the education part, and getting on that hands-on, and that fellowship really sealed the deal for me as a nurse. Like I felt more empowered to be able to
Confident.
confident, and you need that experience. So I think if as we progress, we need like NP fellowships, like things
I
where
like
we
that
can
idea.
that's a great
to
idea.
go to have opportunities for to learn more, without having to be worried, like to have a mentor.
Yeah, so perhaps Paparna can lead this thing, can lead this initiative. So speaking of Paparna, let's talk about it. It's the Philippine American Advanced Nurse Practitioner Association in Nevada. I know, Vian, you're the president. So can you tell us about what that organization is all about?
So this organization was founded by Dr. J. Tan. He is our founder, and Mary Bitita back in 2012, 2013. Like yes.
Okay, yeah.
Yeah. So the mission is to empower all these Filipino APRNs, but it's not limited to Filipino American
right.
APRNs. That we have this collaboration, that we're all going to be together with that vision, like to elevate and empower all these nurse practitioners, not just the older ones, because they already fought for full practice authority. So we're past that. So now we're here. We need to be together to empower each other, collaborate with each other, because this practice, you're doing mental health, you're doing like primary care, you're doing wound. This we're treating like a person, so it has to be like a holistic experience for this patient. So that's our mission and that's our vision. Aside from that, we are very big in education, like PNA. PNA is our like go-to. Like, what are they doing? So we wanted to emulate you guys actually. Like I was telling Jay, I was telling Nikki that like we need to be abreast of what's coming up, what's new, what's required of us. Medicare and all these, they always come up with something new.
Oh my God, yes. I'm now just really understanding that whole Medicare process right now. And so it's like, whoa.
And every year they come up with little things.
Yeah, they have another one. They have a couple of new initiatives for 2025, and it's about discharge planning. So it gets really complicated, and networking with your peers is
Networking,
important.
education, which is we
Networking
have
is
Nikki,
really,
like the last education we did, she did like like our coding, how you get reimbursed, like maximum reimbursement and stuff like that. You're not getting. So those little things like that you do for the community, hopefully like the APRNs would also have will find value to what we do in the
So
community.
very good. So a shout out to all the APRNs out there if you want to join the organization. Yes,
I always say there's strength in numbers.
That's
You can
correct.
always like move forward, like, fight for your cause. But if there's like a lot of you, you're gonna be heard.
That's right. Strength in numbers. I love that. I love that. Do you have anything else to say, ladies, to the community or to your peers?
Ate Emer.
Well, you know what? It's always good to go back to school. So whichever you're thinking you're not too old. Look at us. 20-some years in nursing.
The lessons bounce back. Come back here. Come back here.
Yes, yes.
Yeah.
So that's very good. Anything else, Nikki, that you have to say?
I would say, just be involved, like it's I know everybody's busy and we all have competing challenges in our lives, and it's always good to be involved with the community. And this is a great, PNA and V for Perna, great organizations to find, what you can do to help others, to network, to, gain friendships. Like, I think all of that's important.
Yeah,
it really keeps you grounded and, just keeps you really centered for the work that we
the
do,
work that we
because
do.
it is hard work. I mean,
It sure is.
it's a
It
lot,
sure is.
like what you were
It's a
saying about, I think Laughlin, it's a very challenging
It is.
area.
There are a lot of
And
challenging
there's
areas. Yeah.
not enough, people. Like I had patients who have been trying to get help since July, and I'm just seeing them in November. Like that's
Oh my
really
gosh.
difficult,
Corrupt.
Perrumptu. And
Perrumptu,
so,
yeah.
we go there to see our patients, and so I just feel like you need this community to help get you, like, why it's so important to help continue the the mission.
The mission, yeah. And rural nursing, rural
Oh,
nurse
yeah.
practitioner is a huge challenge to us.
Huge.
So, anyway, you have anything else to say?
Oh no, Ate, I would just like to thank you for giving us this opportunity
Yes,
to
of
be here and
course.
be heard.
Yes.
And
yes.
I know a lot of people that have not heard about Faperna,
Mm-hmm,
but thank you for giving us this time slot, this
Oh,
platform.
of course. It's an honor to have you guys here. I know that, thank you very much, by the way, for to all of you ladies for coming to our program today. And it's to tell us about what nurse practitioners are all about, your challenges, your goals, and it's we really appreciate all of you. So thank you so much, and more power to you.
Thank you.
Yeah, thank you.
Mabuhay. Yes. And to our listeners and followers, we leave you with this. 2023 statistics say that Nevada is number 2 or in the top paying states for nurse practitioners, with California being the first. The third is Washington, the fourth is New Jersey, and the fifth is Oregon. So expanding the nurse practitioner practice authority produces many benefits for healthcare consumers. It increases the availability of healthcare providers who can diagnose and treat conditions. We are lucky here in Nevada that NPs are given the full practice authority. And during this Thanksgiving season, we give special thanks to our nursing practitioners. So thank you so much for joining us today. Thank you for giving us the privilege of your time. Happy Thanksgiving to y'all. This is Doris Bauer, your Philippine Nurse host, signing off for now.
The Philippine Nurses Association of Nevada has just brought you Philippine Nurse, news and features about the Filipino American nursing community and beyond.